This wind, part of the changing of seasons, also part of that, the spread of various bugs. The number of respiratory illnesses is skyrocketing across the Finger Lakes region, with nearly 3,000 cases in Monroe County this year alone, with hospitals strained trying to keep up with this new caseload. Senator Chuck Schumer is calling on the government to help out. Christian Garzone joins us now in studio with more on this. Christian.
Adam, both RSV and the flu are coming way earlier than normal this year. Dr. Stephen Cook said we still have a ways to go this season, and more resources will be needed. Dr. Stephen Cook with Golisano Children's Hospital says with respiratory syncytial virus, they're seeing a lot of cases.
It's very concerning, but it's important to understand exactly what each disease does.
RSV, he says, affects all of us, but it hits adults and kids differently.
Age group we worry about are kids under a year, especially under 6 months. Those are the ones who get the sickest.
RSV starts out feeling like a cold, then it becomes a respiratory problem with conditions lasting weeks. Cook says there's another concern here for hospitals.
It's coming way earlier than we normally see it. And we're seeing flu now at the same time.
The hospital system, he says, is short on staff. Today, Senator Chuck Schumer called on the U.S. Department of Health and Human Services to do more for our region.
We need our hospitals in upstate New York and in rural New York in particular to have the resources they need without getting overwhelmed.
Cook says as the season progresses, the extra support will be needed.
Our call volume is probably twice of what it normally is. And we're trying to accommodate that.
Cook added it would help more if HHS would have Medicaid payments, which mostly cover kids, be the same as Medicare payments. Adam, right back to you.
All right, Christian, thank you. Cook did add, thankfully, this season we have yet to see any deaths caused by RSV or the flu.